Heart murmurs, symptoms and when to see a doctor. Heart murmurs are sounds such as whoosing or swishing made by rapid, choppy or turbulent blood flow through the heart. The sounds can be heard with a device called a stethoscope. A typical heartbeat makes two sounds like lub-dub when the heart valves are closing. Heart murmurs can be present at birth or congenital or develop later in life, acquired. Some heart murmurs are harmless or innocent. An innocent heart murmur is not a sign of heart disease and does not need treatment. Other heart murmurs may be a sign of a serious heart condition. Tests are needed to check the heart and heart valves. Heart murmur treatment depends on the cause. Symptoms: harmless or innocent heart murmurs usually don't cause any other symptoms. Symptoms of worrisome heart murmurs depend on the cause. Heart murmur symptoms may include blue or grey fingernails or lips, chest pain, cough that does not go away, dizziness, swollen liver, swollen neck veins, fainting, heavy sweating with little or no activity. In infants, poor appetite and lack of growth, shortness of breath, swelling or sudden weight gain. Causes: a heart murmur is caused by rapid, choppy or turbulent blood flow through the heart. A heart murmur may happen when the heart is filling with blood or diastolic murmur, when the heart is emptying or systolic murmur, throughout the heartbeat or continuous murmur. Harmless or innocent heart murmurs. A person with an innocent murmur usually has a typical heart. Innocent heart murmurs are common in newborns and children. Things that might change blood flow and cause an innocent heart murmur include fever, lack of healthy red blood cells that carry oxygen to blood tissues, or anemia, overactive thyroid or hyperthyroidism, phases of rapid growth such as adolescence, physical activity or exercise, pregnancy. Innocent heart murmurs may go away over time. Sometimes heart murmurs continue for life without causing serious health problems. Worrisome heart murmurs. In children, worrisome murmurs are usually due to a problem with the heart's structure that's present at birth or congenital heart defect. Congenital causes of worrisome heart murmurs include holes in the heart. A hole may form before birth in the wall, between the upper or lower heart chambers, or both. Examples are atrial septal defect and ventricular septal defect. Cardiac shunts. A heart structure problem present before birth or congenital heart defect causes irregular blood flow between the heart chambers or blood vessels. In adults, worrisome heart murmurs are usually due to heart valve problems that develop later in life or acquired heart valve disease. Things that can damage the heart valves include calcium deposits. Calcium deposits can cause a heart valve, such as the mitral valve or the aortic valve, to become stiff and narrow, which is called valve stenosis. A calcified valve also may not close completely, letting blood flow backward. The changes in blood flow create a murmur. When calcium affects the heart valves, it's called calcific or degenerative valve disease, infection of the inner heart lining and valves, or endocarditis. Bacteria or other germs cause this infection. The germs spread through the blood to the heart from another part of the body, such as the mouth. A murmur may occur if the infection is untreated and affects the heart valves. Rheumatic fever. This is a serious complication of strep throat. It's rare in the United States. Rheumatic fever may occur in those who does not get or complete treatment for strep throat. When rheumatic fever affects the heart valves, it's called rheumatic heart disease. A heart valve problem can cause a murmur. Treatment. Innocent heart murmurs does not usually need treatment. If a fever or an overactive thyroid or hyperthyroidism causes a murmur, the murmur usually goes away once that condition is treated. Treatment for a worrisome heart murmur depends on cause. A worrisome heart murmur requires close monitoring by a health care provider. Medications or surgery may be needed. Medications. Medications that might be used to treat heart conditions associated with murmurs include blood thinners. This type of medicine prevents blood clots. Some conditions that cause heart murmurs are closely linked to irregular heartbeats or arrhythmias that can cause blood clots. Blood clots increase the risk of stroke. Water pills or diuretics. This medicine removes excess fluid from the body. A diuretic may be given to treat high blood pressure or other conditions that can make heart murmurs worse. Angiotensin converting enzyme or ACE inhibitors. This type of drug lowers blood pressure. High blood pressure can worsen underlying conditions that cause heart murmurs. Beta blockers. A beta blocker lowers heart rate and blood pressure. In the past, many people with worrisome heart murmurs are told to take antibiotics before surgery or dental procedures to prevent certain heart infections. That recommendation has changed. Antibiotics are only recommended in specific situations. For instance, they may be recommended for people with artificial heart valves, a history of heart valve infections, or congenital heart defects that increases the risk of infection inside the heart. Surgery or other procedures. Surgery may be needed to correct a condition that causes a worrisome heart murmur. For example, if a narrowed or leaky heart valve is causing the murmur and other symptoms, heart valve repair or replacement may be needed. During heart valve repair, a surgeon might patch holes in a valve, separate valve leaflets that have fused, replace the cords that support the valve, remove excess valve tissue so that the valve can close tightly, tighten or reinforce the ring around a valve. Heart valve surgery may be done as open heart surgery, minimally invasive heart surgery, robotic heart surgery, a procedure using flexible tubes, or catheter procedure. The way the surgery or procedure is done depends on the specific heart condition. When to see a doctor. Most heart murmurs are not serious. If you are concerned about a heart murmur, make an appointment to see your primary care provider Your provider can tell you if follow-up care is needed. Prevention. There is no known prevention for heart murmurs, but healthy lifestyle changes can improve heart health and prevent some conditions linked to murmurs in adults. Many childhood heart murmurs go away on their own as children grow.